Can post-exposure prophylaxis be used after exposure to hepatitis B or C? Have you ever wondered if there is a way to prevent infection after being exposed to hepatitis B or C? Let's break it down. Post-exposure prophylaxis, often called PEP, is a medical intervention that can be a lifesaver in certain situations. For hepatitis B virus exposure, PEP is an established and effective option. It typically involves getting the hepatitis B vaccine and, in some cases, hepatitis B immune globulin. This combination can help prevent infection if administered promptly after exposure to contaminated blood or bodily fluids. Timing is crucial here. The vaccine series should ideally begin within 24 to 48 hours after exposure. However, it can still be effective if started within 7 days. If the source of exposure is known to be positive for hepatitis B surface antigen, or if the person exposed has not been vaccinated or is a known non-responder, then hepatitis B immune globulin is recommended. Research shows that giving immune globulin within 7 days post-exposure is nearly as effective as giving it within the first 24 hours, especially for healthcare workers who may face occupational exposure. Now, what about hepatitis C? Unfortunately, there is currently no approved PEP regimen for hepatitis C virus exposure. Unlike hepatitis B, there is no vaccine or immune globulin available to prevent infection after exposure to hepatitis C. If someone is potentially exposed to hepatitis C, the focus shifts to early detection through testing and prompt antiviral treatment if an infection occurs. In the context of sexual health and sexually transmitted diseases, it is vital to seek timely medical evaluation after potential exposure to hepatitis B. This can help initiate PEP and prevent chronic infection and liver disease. For hepatitis C, the best strategy is to reduce exposure risk and ensure early diagnosis rather than relying on PEP. If you have concerns about exposure to either hepatitis B or C, it is essential to consult a healthcare professional. They can provide personalized advice based on your vaccination status, the level of exposure risk, and the infection status of the source. This approach ensures the best chance of preventing infection or managing it effectively if it occurs.